appreciate that. With that, I'm going to turn to the young lady to my left.
My name is Brooke.
Okay, you need to creep right up on that microphone and yell at us, please.
My name is Brooke Drake.
Thank you, Brooke.
I was wondering why PPH has not shown in the houses and if it could be because the high freezing point of 66 degrees Fahrenheit causes the substance to accumulate into an ice-like substance and float past the water intake. If this can be a possible cause of that, will it be more of a problem come summertime?
I'm going to turn to Dr. Eaton or to Mr. Nesler to address that. Did you hear the question? Let me try to paraphrase and correct me if I miss it. The question was why we did not detect any PPH in any of the samples. Was it because it was in low concentrations, or was it because of the physical characteristics of it and its relationship, I believe, to temperature and its probably its volatility based with temperature?
Yes, I think the simplest answer is we feel we didn't detect the PPHs because it would have been at concentrations that were substantially below the 4 MCHM. In the crude, we determined that the 4 MCHM and looking at MSDS with DSs was in the crude at approximately 80%. So and then the PPH was at levels that were anywhere from 2 to 5%. 2 to 5%, I believe, if I recall correctly, off of the MSDS. So if you do the math and figure that we had 80% in the crude, 4 MCHM, now we're down at 2.4 parts per billion, that would have put your potential PPH concentration at something well below what we were able to analyze for. The data we showed when Dr. Eaton and I gave our presentation, we showed all 4 MCHM data, and that was because we didn't detect the PPH, but our performance for PPH and doing that analysis was exactly the same. We were able to see it down to 0.5 parts per billion like we were the 4 MCHM, and did not detect any in any of the house samples.
Okay, does that answer your question?
Do you think that you might, once summer comes around and the PPH, even if the 2 to 5% solution is no longer frozen within that solution with a 66 degree Fahrenheit freezing point, as the temperatures heat up, will you possibly find PPH in homes then?
I would think not, based on the volume of water and the flow that's gone through this period of time. But I quite frankly I don't know for sure. I would suspect not, but I don't know for sure.
Michael, did you want to pipe in?
Very briefly, for something like this, you try to look at fate and transport of organic compounds, which we have a lot of experience with other compounds, not with PPH. It would be very unusual for something like that to happen. You can never say never, but looking at the kind of compound it is and looking at the systems that we're talking about, it would be very unusual.
Thank you. The lady to my microphone, to the right, microphone at my right, please.
Linda Sedero. How is your testing, which took 3 weeks, different from the National Guard's testing, which took hours?
I'll start. A lot of that has to do with the questions again that were being asked, and also with the logistics involved. The Army National Guard had an army to go out and do the sampling, and again, I have to say that not only did it have an army to do the sampling, but yet an army of just exceptional individuals. We have all been just unbelievably impressed with the National Guard in West Virginia and with General Hoyer and his entire staff. The other side of it is that we had a different level of rigor that was required of us, and we were looking at things at a much deeper level of detail. That meant that we needed to pay special attention to the quality control of the data, and also to the organization of the data. The National Guard got their results. They were looking for a single number, which was the concentration. We were looking at a lot more data, and also applying a different level of rigor to that as far as the quality control goes. We didn't have an army, we had an army of 3, doing our sampling, and we felt that it was very important that we not put the data out as it came out of the laboratories, but that it be put into some kind of a context. An example of that would be that the peak that Chuck Neslin showed you, that the tentatively identified compound that was way over on the right of his graph, if we had reported that early on, there may have been panic. And it turned out that it was an artifact. That would have not have served people well, nor would it have been good science on our part to release that information any more quickly. We apologize that it took us the amount of time, but this was the amount of time that was required to do the science with the rigor that this team insisted upon.
Thank you.
You're welcome. Sir?
Yes, Joe Merchant. I have a question about, my family, we found out about the no drink order very quickly, so we were able to limit exposure in our household as far as drinking or even exposure to it on our skin. But after the ill-conceived plan by West Virginia American Water for the flushing, when I started flushing our house, when my daughter and my wife were out of the house, the only reaction that I had was to the steam, and it gave me bad headaches. It caused my throat irritation and eye irritation. I guess not to the level that I felt I had to go to the hospital, because I sort of knew it was coming, I guess, horrifically. And so I just wanted, did any of your testing include the steam? Or is there any way for you guys to test what happens, to what level or what reaction within the steam?
I'm going to turn that question to Dr. Well.
When I was up here January 17th and 22nd, I also experienced dizziness symptoms when I was flushing a bathroom that wasn't well ventilated. So I can relate to you and a lot of individuals that went through this experience. There are ways that you can determine the concentrations of chemicals in air without actually measuring them in air. What you need to do, though, is you need to understand what chemicals are present. And that's really important in terms of understanding Dr. McGuire's work, because we work with crude MCHM throughout our entire project. We did not do any monitoring of steam in this project. I have been stating since day one that somebody needs to do some type of toxicology study. Expert panel is certainly effective and important, but somebody actually needs to start doing the hard science associated with the chemical exposures. To my knowledge, nobody has done that yet, and I have heard through the grapevine that there are some academic researchers that are working on it, but they are not in a position to talk about it in public.
And I also would ask Dr. McGuire to speak to some of the experiments having to do with hot water versus cold water that you guys did at UCLA.
We did do some limited odor panel work with experts. When we heated the water up to 45 degrees centigrade from 20 degrees centigrade, the 20 degrees was essentially room temperature, and we were able to detect the licorice odor. This was actually a low concentration, about 2 to 3 parts per billion. When we heated the water up, we just got blasted out by the chlorine because chlorine was volatilized and masked the licorice odor. So it's a very complicated situation, and just knowing what's in the water doesn't necessarily tell you what's in the air or the steam, but this is what we know so far, and well, it's what we know.
Thank you. The lady at the microphone to my right, please.
Yes, I'm Pam Nixon. And
Yeah, Pam, could you get closer to the microphone, please? Thank you. Tilt it down if you need to. You can grab it and break it down. Thank you.
Okay, I'm Pam Nixon, and early on there was discussion about the half-life of the MCHM, and then there was a report to the legislature from one of a college professor about formaldehyde in the water. When you were testing the water with the gas mass spec, did you find any formaldehyde, and do you know whether that is a byproduct of breakdown of the MCHM?
Andy, please. Thank you.
At the very beginning of the project, one of the things we actually thought might be responsible for the odors was not MCHM, but aldehydes. So we did testing at one house before the 10-house survey started, looking for a long list of aldehydes, which did include formaldehyde. We did detect formaldehyde in a couple of those samples at levels of 10 parts per billion. To put that in perspective, the World Health Organization set a standard way back in the mid-2000s of 900 parts per billion of formaldehyde. They then dropped formaldehyde as a drinking water standard in 2011 for two reasons. First off, they didn't think it was really relevant as an ingestion hazard, and also formaldehyde is formed directly in the body, so they didn't see drinking water as a significant component. The other thing that's relevant to that is it's very difficult to analyze for formaldehyde at those levels because you find it everywhere. Way back in the mid-90s, when some of us were working together on another project, EPA wanted people to analyze for a number of aldehydes as potential disinfection byproducts in water. And they initially said, we're going to analyze to 1 part per billion. Within 2 weeks of the time they started working on methods development, they said, we can't analyze that low because we can't control blanks to that level. So the bottom line is we don't think formaldehyde is a huge issue on this.
I hope that answers your question. Gentleman behind you, microphone to my right, please.
Yes, I'm Jesse Johnson, and among other things, I'm an affected citizen in this case, and I was going to ask about the MCHM crude versus the SureFloat or flocked 944 that's been talked about as to which really was what was spilled, but I want to dovetail into Brooke from West Virginia Citizens Action's very astute question about the PPH and it not showing up in any of your data. PPH is what I've been able to ascertain was also a component of Corexit, which was used as a dispersant in the Gulf of Mexico. And so it made me wonder at what level is the intake for West Virginia American Water, and is it possible that the PPH was knocked down to a level below that due to, or that PPH bound to something and dropped it to below that level, and therefore it's not really showing up in the output of the water.
I'm going to turn that to our chemists because I'm not sure where to go with that. Chuck or Andy?
So if I understand your question, I think you're inferring that the PPH is more dense than water. So you think that the PPH would be residing at a lower level. But I thought the Corexit that was used in the Gulf and the application there was actually for the dispersion of hydrocarbons, because then PPH and the other materials, the other alkyl sulfonates and like that they used in those materials, when they got into hydrocarbons, they dispersed them so that then it made it, basically broke up oil slicks and allowed it to, in a more natural fashion, to be attenuated by bacteria and other organisms. In this case, we don't have any evidence or any indication that the PPH would be more dense, would sit at a lower level in the river, and or that from the way the water is taken into the treatment facility, that there would be any discrimination between how PPH is introduced versus into the water treatment facility and then out to the distribution, as opposed to the 4-MCHM. And then on top of that, our analysis, we basically had similar, exact same sensitivity of analysis for the PPH as the MCHM, had developed our analysis so that in one extraction and analytical run, we looked for both of them at the same time. But in all the samples that we had no detections of PPH. So that's the reason for us drawing the conclusion that PPH was, it's not a material of concern in this case.
Well, if I may.
I'll allow, you can have a follow-up, but please be brief.
Yes, well, it's just that my understanding was that also in the Gulf that it had sunk and caused these underwater plumes, et cetera. That may or may not be true, as what was reported. There's also reported that the PPH was 7%, basically in the tank with the MCHM crude, et cetera, and I don't know whether that's considered mixing or manufacturing of those being in that tank together. But if they were released together, then I was just curious why it wouldn't be showing up along with it showing up with the MCHM showing up in every household that you tested.
Right, and that goes to our ability to sense, or our ability to detect it at the if it's there at the concentrations that are present. So to use the number you gave, 7%. If a 4-MCHM was at 80% and PPH is at 7%, so PPH is 1/10 of what the 4-MCHM is. So now if we go to our analytical results, so the average was 2.4 parts per billion. If it was there,